Alrighty, welcome, Mr. Nafi Homan, back into the clinic. Nice to see you again. Today, part of our treatment is to just make you more aware of your situation in regards to sedentary lifestyle, its risk, and what is associated with it. And we're going to be providing you with a small discussion regarding your test results as well. And before we begin, do you have any questions?
No, let's just go straight into it. I mean, I'm interested because I did my own research, but just, at surface level, gave me some anxiety, and I think you're going to teach me the facts from more professional sources, I'm sure.
Yes, okay. So,
Cool.
1 second. 1 second. Alright, so, this session will take around 10-15 minutes. It won't take too long. This video right here regarding, this is very simplest, it will explain sedentary lifestyle and its risk factors in a very, very understandable way for all of us to understand. And if you were to have any questions regarding it, even during the video we can pause it and we can further explain. And then we're going to be discussing more about the results upon the other factors, okay?
Interesting.
So, we're going to play the video now. Enjoy.
Let's go.
Here's what happens to your body when you sit for many hours almost every day.
Wait,
Wow.
1 second.
The ads might pop up again.
I'm not finished.
Okay, good.
Here's what happens to your body when you sit for many hours almost every day. Your blood circulation slows down. When you sit a lot,
Wow.
you move less, therefore not giving your heart a chance to pump blood to your organs and body parts efficiently, thus not delivering enough oxygen and nutrients to organs, limbs, and brain.
I don't
This
have a
leads
heart.
to slower cell regeneration because toxins and waste product removal are not optimally achieved. Insufficient blood flow can also be the cause of swelling, numbness in the legs, and eventually varicose veins, because the blood that is returning to the heart is slow to return and pools in the lower legs. Muscle fatigue is a reduction in the force or power that the muscle can produce, and it commonly happens due to a lack of exercise leading to slow oxygenation. A fixed position, e.g. sitting upright, requires the muscles to hold the trunk, neck, and shoulders in a fixed place, reducing the blood supply to the working muscles and causing fatigue. Sitting for an extended period also leads to the weakening of the large leg and gluteal muscles, increasing your chances of injury when you get to exercise. The insufficient activity also leads to muscle mass loss, which can result in joint inflammation and osteoarthritis. A sedentary lifestyle makes you prone to bone fractures due to osteoporosis. Osteoporosis is a condition of extremely weak bones, which results in loss of bone mass. When you're not loading your body, e.g. doing weight-bearing exercises, you are not providing a loading stimulus to your skeletal system. You
Can I
could get
pause the
pain in
video?
any joint, however lower.
Yes, everything clear so far?
Okay, I do have one question that popped up in my mind. It said that having a sedentary lifestyle would lead the risk to injury when I start exercising, and I think you're going to start recommending me some exercises, so I hope the exercise that you recommend have a low risk of injury.
Yes, of course. We're going to be, the test that we're going to do takes into consideration of your fitness itself. Yeah.
Okay, thank you. And I
But-
did say I wanted light exercises.
Yeah, precisely, yeah.
Good.
But everything is clear. Any questions so far? We just taking a little short break.
I'm good.
Good.
How's the view?
All right, so we're going to finish the other half. There's only 3 minutes. Where's the mouse?
Yeah, let's click on it.
Back pain seems to be the most common complaint of those who spend long hours sitting down. The more pain you experience, the less likely you are to exercise and be active, resulting in more pain, creating a vicious cycle, and eventually weight gain and other problems associated with that.
That's
You have an
interesting.
increased risk for type 2 diabetes if you lead a sedentary lifestyle.
Huh.
Prolonged physical inactivity leads to insulin resistance, which is when cells in your body don't respond well to insulin and can't easily take up glucose from your blood, whereas an active lifestyle makes your cells more responsive and take so that there is less in the bloodstream, thus helping prevent or delay type 2 diabetes. Sitting down slows digestion because it causes your abdomen to compress. As a result, you could get bloated or constipated. Being constipated means your bowel movements happen less often than normal. A sedentary lifestyle also harms your mental well-being. It is associated with depression, anxiety, and chronic stress. Over time, you may find your motivation decreases, and it becomes difficult to go and do things that you used to enjoy.
Alrighty. So,
That was really eye-opening.
yeah, so any questions about what has been explained so far to you?
Well, that probably just worsened my anxiety. It's pretty scary, I think, for all those risks. I don't think I have any questions.
No, you don't?
Just that comment.
So what did you learn so far from the video? What would you say you understood, and what would you like to share?
When I came to you, I knew that I led a sedentary lifestyle for quite a long time, and I was feeling all of these symptoms, but I didn't really know why necessarily. And then I watched that video, and I was like, muscle fatigue, back pain. And then the cycle of just like, you do less exercise, and then you have more pain, which is a cycle of leading you to do less exercise again. And it's like, that's what my life has been like. So it was very, very eye-opening, as I said.
What would you say you would want to take away when you go home, or when you understand this, when you're in a center lifestyle? What would you say you took away the most?
It's not like a very sustainable lifestyle, I think. I think you need to have a balance with, some people have, office jobs, and I also just naturally have a sedentary lifestyle where I want to work and use my laptop all day for business, productive things, hobbies, and also my just relaxation activities. But you should balance that with actually being active as well to reduce the risks of what was mentioned in the video. So yeah.
And it mentioned something about something mental. What would you say, like, with sedentary lifestyle? What would some of the mental risk be associated with sedentary lifestyle? As it mentioned some, what would you say you took away from that part? I felt like you had a very close connection with our case, especially with what you described with anxiety.
Yeah, anxiety. I don't know, I just thought it was kind of funny. It's true. I think one very big reason why a sedentary lifestyle might lead to depression or anxiety is maybe this instinctual understanding for human beings to not stay inside all day and be attached to technology and their laptops. Maybe we have this understanding that human beings are meant to go outside and be active, but that part is kind of like missing. And in the modern day, where technology exists, and we started to become addicted to it, and we start to lose touch with other people and going outside to meet them. That's what we're missing by staying inside all day, and that might cause some depression and anxiety in some people, and me definitely slightly, somewhat. Yeah, pretty much. That's it.
So you would say, like, you saw the mental consequences of the sedentary lifestyle, on how it impacts you socially, and how it can even lead to depression and buildup of anxiety. Yeah. So since you know this now, what would you say? How does it make you feel on how you're moving forward with sedentary lifestyle?
Well, definitely slightly more motivated, because now I know, I might get, there's a risk of diabetes and osteoporosis, and I'm like, that those seem pretty scary to me. I didn't even know that there's actually a risk with the sedentary lifestyle, but now that I do, I'm motivated to not continue it, or at least have a balance between doing what I want, which is whatever I do in a sedentary lifestyle, and being more active. So there you go. Motivation is the key word, I think.
So it gives you motivation. How diabetes, all these risk factors, osteoporosis, which has to do with your bones, degradation of the bones,
Yeah.
and your joints, how it can affect you, and how it can quickly come onto you if it's not tackled and not dealt with soon as possible. Okay, so knowing this, we'd just like to go on to the second portion of our presentation, which will be this. So this is the results from your test that we did, and everything except for these two were well done.
Cool.
So we checked your height, your weight,
No.
your grip strength, your length, flexibility, blood pressure. Everything was in the green. And we had these two ones that we did, which was the jump height and the sit-ups, where you got to achieve the score of 22.1 inches. And you also had sit-ups, which measures your core strength, which you did 22 of them. The norm value is around 25 to, the norm value for your age is 21, so it's supposed to be around 25 to be in green, and you achieved a score of 22. So this tells us that we can work more on your core strength. And regarding your jump height, which is 22.1 inches, the norm value is between 21 to 30 centimeters high, and you achieved a score of 22.1, and that the norm value is supposed to be higher than 22 30 centimeters for your age, but you achieved between 21 and 30 centimeters, which is what we can work on also as well.
Okay.
Yeah. So before we delve deep into so the aerobic training, some resistance training, we would like to, what would you say, like, and we have some exercises prepared, but we have a test that we're going to be doing, which is called the treadmill test. We're going to be assessing your aerobic cardiovascular fitness first before we get into doing some aerobic training.
Okay.
Yeah. So that will be done at the gym. Any questions?
I did have three. Okay, the first one is kind of just like, what do these mean technically? Because so having a very poor amount of sit-ups means I have a poor core strength.
Mm-hmm.
I assume a low jump height means, I don't know, my legs are not as powerful as the standard for my age. I assume that's what they both mean, and we could improve on that.
Mm-hmm.
Okay, I suppose that's the first question answered. I guess the second one is that I'm not super interested in improving those areas, although if they do even indirectly affect reducing the risk of a sedentary, the negative parts of a sedentary lifestyle, then I suppose I'm interested in
That's great. We're
improving those areas, yeah.
Yeah, 100%. We're here to work out on achieving your goal, which is to increase more physical activity within your daily schedule. And I would like to have some more clarity per se on that exactly. So you said you want more physical activity within your schedule, but what does that really mean exactly to you? How do you really plan to carry this out? How do you want it to be carried out?
Okay, sure. I don't necessarily need physical activity. Just whatever reduces the risk of the negative effects of a sedentary lifestyle. Although I will pretty much assume that light exercise is required too, because obviously the problems with a sedentary lifestyle is staying still, so being more active is naturally the answer. How I plan to carry it out is that I have, like, I don't have the best sleep schedule. I sometimes, it depends, it's actually a bit shaky, but I suppose on a usual day, I wake up at around 8 a.m. And then at around that time, I am actually just like, a bit too, what's the word? Lethargic, I suppose that's the word. I don't have enough energy to be doing too many things. And sometimes I'm just so lazy that I just go back to sleep or something. But I think with these light exercises and the fact that I want to do them like really first thing in the morning so that later on in the afternoon I can do whatever I want, that would motivate me to go up and get out of bed and do something productive in the morning, I suppose. So that would be very nice. That's how I plan to fit it into my schedule.
Okay. When would you say you're satisfied? Like, what has to take place with your goal to be satisfied? When will you be satisfied?
The thing is that it's impossible to tell the benefits of these exercises, especially like in a short time period, because the main problem is to, like, this isn't like curing my current disease or anything. I don't have osteoporosis or whatever yet. I'm preventing it from happening in the future. So I think what it is affecting me right now is just my anxiety, and as long as that is gone from my head, I suppose that would equal me being satisfied. And I think that would indirectly also mean that I do stay away from those risks naturally, because, if I do exercise, then the risks of sedentary lifestyle would be reduced. So there you go. So I think my anxiety being gone would be the main answer.
Okay, so for you to feel satisfied with achieving your goal, which is to decrease sedentary lifestyle to increase physical activity within your schedule, is for the decrease that when you feel less anxiety, the looming anxiety over your head about sedentary lifestyle.
Yeah. That.
Okay.
I hope that made sense.
Yeah.
Okay.
Okay, I understand. So it's not per se about you wouldn't what would you say the anxiety, like, how does it exactly make you feel? Because we would have to we're gonna assess that as well. So, like, how do you feel? How's the anxiety affecting you now? Throughout your daily living, your daily functioning, your schedule.
I mean, no, I'm just saying that I don't really enjoy those kind of probing questions. I hope I can just say, okay, I'm doing these exercises, I don't feel anxious anymore about this, and then that's the end. Like, it's successful. You know what I mean?
Yeah, I do.
I prefer as something that's not like a really, what's the word, a rigorous assessment of my anxiety or anything. I think it's just based on my mood or my vibe,
Oh, your mood and your vibe. Okay. So you don't want nothing too rigorous, nothing too...
Assessment, yeah.
Yeah, in terms of assessing how you feel. So that's perfect, because we actually do have that's very simple, straight to the point, not too many questions regarding how you feel exactly. With anxiety, how you feel. Specifically with how you feel, instead of the anxiety, we do have a way to assess that.
Okay.
So we're going to be sending that questionnaire to you, and we're going to be using it as a reevaluation in the future as well. So we know that we're seeing progress.
Yeah. No, I do also prefer the form of a questionnaire that I fill in and write instead of like an interview again, So that'd be nice.
Yeah, sure, that's perfect. All right, great. So that's it for today. Do you have any questions?
This is more like a practical question, but I think I can only go to the gym for free like twice. So I hope that we only go there twice at most for the treadmill test. And whatever exercise that you plan for me to do, I hope they don't involve using the gym. So
No,
there
because
go.
you want to exercise within your comfort zone.
Yeah, exactly.
So
The gym is not that.
Hey, if you want gym, we can put in gym.
I said it's out of my comfort zone.
Okay. Yeah. Hey, we have multiple options that we can choose. Exercise that we've already provided, and we'll provide you with a variety of more that will fit you in your at your home. But we also have aerobic training that revolves outside, walk around with your friends, etc., etc.
Yeah, that's fine.
Yeah. All right. So thank you so much for coming. We'll see you very soon.
You too.